Hello, I'm Wes Warren, and I'm President and CEO of Whitehall Management. Today I'm going to be talking about marketing, and that is getting your marketing to work. And we're going to be covering what I consider the #1 mistake that everybody makes in marketing, especially in dentistry, is they violate my #1 rule, and that is be seen. The #1 mistake that everybody makes is their pieces blend in to every other marketing piece out there. You have to pull people's attention to awareness, and it's very difficult to do. People's brains work in alpha and beta state. When you're doing schoolwork or when you're doing dentistry, you're acutely aware of your surroundings and everything around you, and you're focused. But most of the time, the brain works in beta state. You'd be nuts if you were in alpha state all day long and acutely aware of every little detail around you. No, your majority of your time is in beta state. This is why we can run commercial and commercial and commercial and get no results, and nothing happens as far as getting new patients, is because you actually didn't pull people out of beta state and get them into alpha state. You did not make people see the ad. And that's your first challenge. So when you're looking at your marketing pieces, you got to flip through them with a bunch of other pieces and say, does this jump out at me? Is this different? Is this something different? That's the #1 thing you can do to make your piece jump out. Our minds are trained to become acutely aware of things that are different. Anything that's different we see out there, and I mean at any point, our minds just immediately come to focus and look at that. So like an example of being different would be, if you're doing direct mail, would be an odd shaped piece. In other words, mail comes in a pretty standard form, but if yours is oblong or a little bit different, it will jump out. People actually look at it. What's on there as far as the pictures, the more you look like everybody else's ad, the worse your ad will do. The response rate will be dramatically reduced. The other thing you can do is to be familiar. Yes, what do you mean be familiar? Think about when you first bought your last car. Before, you never even noticed them on the road, and then immediately when you bought your car, you're seeing that Lexus or whatever, that Toyota everywhere now. It's because you've seen something. Your mind is trained to see things that are familiar. So those are the two things you can do in your piece to actually make an impact and get people's mind from beta state to alpha state. And that's the #1 challenge, is to get people to see your piece. So something that is familiar would be something that is near and dear to my heart. So if I am scared of the dentist, and you run a big fear piece about being scared, well, that's familiar to me and my emotions, and so I will connect to that piece. Other things would be if I had a gap in my tooth that I was really embarrassed about, and you did an ad about implants. Well, that is something that is familiar to me. Those are examples of being how to make your ad more familiar to people. So remember, there's 2 golden rules of being seen. One is to be different, and one is to be familiar. Let's go back to different again. The other thing you can do to be different is choosing the right picture. The more professional the shot, actually the ad will blend in with all the other pieces. The more it looks like just a regular photograph, the better it'll do. So the more it looks like an actual patient and not a professional shot, you actually do better. So those are the 2 things you can go to home and do immediately to get better results.